What is CAR T cell therapy? CAR T cell therapy is a kind of immunotherapy that uses genetically modified T cells. T cells are a type of white blood cell. There's many kinds of white blood cells. In fact, there's several kinds of T cells. And some T cells are cytotoxic, which means they can kill cancer cells. The percentage of cytotoxic T cells is very, very, very low, fraction of 1%. Now, from a patient's point of view, I'm going to explain how CAR T cell therapy is carried out, basically. So, if you're a candidate for CAR T cell therapy, I think it's mainly used for blood cancers at the moment. You would go to hospital or clinic and have some white blood cells extracted, and then these cells are processed. The T cells are kind of separated out. The T cells are genetically modified for a cancer target, so a specific antigen, and then the T cells are returned to you a few weeks later. It takes a few weeks because when the T cells are prepared with the receptor on, so the CAR bit stands for chimeric antigen receptor. Chimeric just means animal derived. Antigen receptor, so an antigen is a label on a cell that shows it's cancer cell or bacteria or that kind of thing. And the receptor is the bit almost like the socket on the T cell. So when this has been done, where the cells have these receptors on, you also need a huge number of these T cells. That's why it takes so long to prepare and grow these cells, a few weeks. And then you return to the hospital or clinic and have your IV drip, intravenous drip, and get the cells back. Now, CAR T cell therapy is dangerous. It's a dangerous kind of immunotherapy. So it's very common to have the treatment as an inpatient procedure. So when you're staying in the hospital. When it started, I think you would be in the hospital for like 30 days. With CAR T cell therapy, I think you'll always or almost always need some chemotherapy before you have the CAR T cells via the drip, and that's to deplete the T cells in your body, and that has an issue because chemotherapy is not good for you. And then the CAR T cell therapy itself is potentially quite dangerous. There's some various side effects. So one possible side effect is a cytokine storm, or what's it called? A cytokine response syndrome, I think, CRS. So with the cytokine storm, the body, I guess, is making lots of cytokines, and all the cytokines are moving to the site where the CAR T cells have been put in, and that's a dangerous thing that you do not want. Another like family of side effects is related to nerve damage. There's some temporary stuff, and there's also some permanent or potentially permanent stuff. And those nerve side effects usually, I think, happen about a week after the CAR T cell injection, on average, but can occur for a month or so after. Which again is why it's very important to be in a situation where you're monitored, and that's why this is often done as an inpatient procedure. I think that's kind of starting to change now because people are more and clinical practitioners have more knowledge and experience about managing the side effects and about watching out for the dangerous side effects and about treating the side effects. So that's CAR T cell therapy, so chimeric antigen receptor therapy. Personally, I think it's a dangerous therapy and shouldn't be used, but don't let me influence your judgment. You need to make a decision talking to clinical practitioners. And I guess if you don't have any other options, then yeah, obviously consider having CAR T cell therapy if you're a candidate. Hope that has been useful.